ሰላም እንደምን ቆያችሁ ውድ የዱቡሻ ሄልዝ ቲዩብ ቤተሰቦች እንዲሁም አዲሶች ላይክ ሼር ሰብስክራይብ ስለምታደርጉ እጅግ በጣም አድርጌ አመሰግናለሁ። የዛሬውን ቪዲዮ ከመጀመራችሁ በፊት ላይክ ማድረጋችሁን አትርሱ። ወደ ቪዲዮ
Social media and mental health. In today's world, many of us rely on social media platforms such as Facebook, Twitter, Snapchat, YouTube, and Instagram to find and connect with each other. While each has its benefits, it's important to remember that social media can never be a replacement for real-world human connection. The negative aspects of social media. Since it's a relatively new technology, there's little research to establish the long-term consequences, good or bad, of social media use. However, multiple studies have found a strong link between heavy social media and an increased risk for depression, anxiety, loneliness, self-harm, and even suicidal thoughts. Social media may promote negative experiences such as 1. Inadequacy about your life or appearance. Even if you know that images you're viewing on social media are manipulated, they can still make you feel insecure about how you look or what's going on in your own life. Similarly, we're all aware that other people tend to share just the highlights of their lives, rarely the low points that everyone experiences. But that doesn't lessen those feelings of envy and dissatisfaction when you're scrolling through a friend's airbrushed photos of their tropical beach holiday or reading about their exciting new promotion at work. 2. Fear of missing out, FOMO, and social media addiction. While FOMO has been around far longer than social media, sites such as Facebook and Instagram seem to exacerbate feelings that others are having more fun or living better lives than you are. The idea that you're missing out on certain things can impact your self-esteem, trigger anxiety, and fuel even greater social media use, much like an addiction. FOMO can compel you to pick up your phone every few minutes to check for updates or compulsively respond to each and every alert, even if that means taking risks while you're driving, missing out on sleep at night, or prioritizing social media interaction over real-world relationships. 3. Isolation. A study at the University of Pennsylvania found that high usage of Facebook, Snapchat, and Instagram increases rather decreases feelings of loneliness. Conversely, the study found that reducing social media usage can actually make you feel less lonely and isolated and improve your overall well-being. 4. Depression and anxiety. Human beings need face-to-face contact to be mentally healthy. Nothing reduces stress and boosts your mood faster or more effectively than eye-to-eye contact with someone who cares about you. The more you prioritize social media interaction over in-person relationships, the more you're at risk for developing or exacerbating mood disorders such as anxiety and depression. 5. Cyberbullying. About 10% of teens report being bullied on social media, and many other users are subjected to offensive comments. Social media platforms such as Twitter can be hotspots for spreading hurtful rumors, lies, and abuse that can leave lasting emotional scars. 6. Self-absorption. Sharing endless selfies and all your innermost thoughts on social media can create an unhealthy self-centeredness and distance you from real-life connections. Indicators that social media may be adversely affecting your mental health include 1. Spending more time on social media than with real-world friends. 2. Comparing yourself unfavorably with others on social media. 3. Experiencing cyberbullying. 4. Being distracted at school or work. 5. Having no time for self-reflection. 6. Engaging in risky behavior in order to gain likes, shares, or positive reactions on social media. 7. Suffering from sleep problems. 8. Worsening symptoms of anxiety or depression. Modifying social media use to improve mental health. Step 1. Reduce time online. A 2018 University of Pennsylvania study found that reducing social media use to 30 minutes a day resulted in a significant reduction in levels of anxiety, depression, loneliness, sleep problems, and fear of missing out. Step 2. Change your focus. Step 3. Spend more time with offline friends. Step 4. Express gratitude. Helping a child or teen with unhealthy social media use. If you're worried about your child's social media use, it can be tempting to simply confiscate their phone or other device, but that can create further problems. Separating your child from their friends and the positive aspects of social media. Instead, there are other ways to help your child use Facebook, Instagram, and other platforms in a more responsible way. 1. Monitor and limit your child's social media use. 2. Talk to your child about underlying issues. 3. Enforce social media breaks. 4. Teach your child how social media is not an accurate reflection of people's lives. 5. Encourage exercise and offline interests.